it's Mick with VIP Vet Talk. How are you doing? We're going to talk about PRP today. So what is PRP? Platelet-rich plasma. PRP. That's a platelet-rich plasma injection. In recent years, doctors have learned that the body has the ability to heal itself. And platelet-rich plasma therapy is a form of regenerative medicine that can harness those abilities and amplify the natural growth factors your body uses to heal tissue. So on that note, what is plasma and what are platelets? Aren't they the one and the same? Kind of, not really, sort of. Plasma is the liquid portion of whole blood, and it's composed largely of water and proteins and provides a medium for red blood cells, white blood cells, and platelets to circulate through the body. So platelets are also called thrombocytes, and they are blood cells that cause blood clots and other necessary growth healing functions. Platelet activation plays a key role in the body's natural healing process. What is platelet-rich plasma? So I'm reading off some notes here for you. So make sure we get it right. So platelet-rich plasma therapy uses injections of a concentration of a patient's own platelets to accelerate the healing of injured tendons, ligaments, muscles, and joints. So in this way, PRP injections use each individual patient's own healing system to improve musculoskeletal problems. So it's autologous, which means that it's coming from your own body. So PRP injections are prepared by taking anywhere from 1 to a few tubes of your own blood. I wish they could narrow that down a little bit, like 1 or a few. It could be a few, it could be 10. No, a few. What is that? Maybe 3 tubes of your own blood, and running it through a centrifuge to concentrate the platelets. So these activated platelets are then injected directly into your injured or diseased body tissue. And this releases growth factors that stimulate and increase the number of reparative cells that your body produces. Ultrasound imaging is sometimes used to guide the injection. Please always use ultrasound imaging when they're doing the injections. Say, doc, do you have a high-res ultrasound? I'd really like for you to use that while you're doing the injection, so that way they can see exactly where the injection is going and making sure that it's going into the right place. That can make a huge difference as to whether or not you're going to get optimal results from that. So ultrasound imaging is sometimes used. And then for spine, you always want fluoroscopy, which is a live x-ray for the physician to use while you're undergoing a spine procedure. So high resolution ultrasound guidance for joint specific, and fluoroscopy for spine. Okay. So how do platelet-rich plasma injections work? Platelet-rich plasma has been found to significantly enhance the healing process, and using a PRP injection for shoulder pain caused by rotator cuff tear, try saying that 3 times really fast, or for Achilles tendon ruptures or other soft tissue injuries is becoming more common. Okay. So PRP has also been demonstrated to improve function and reduce pain in people who have tendinitis conditions such as tennis elbow or golfer's elbow. Some of the key advantages of PRP injections are that they can reduce the need for anti-inflammatories or stronger medications like opioids. And in addition, the side effects of PRP injections are very limited because the injections are created from your own blood, and your body is not going to reject or react negatively to them. You just always want to make sure that the injection site is kept clean and that they use sterile pads, and infection would be the only thing really. That I have yet to have seen that happen within our veteran population within our program, but it's a very safe procedure. So there you go. So I hope that helps you for today, not having to read the information, but I can just shout it out to you, and we're going to continue these types of videos going through as we move forward. Okay, a little bit of info here, a little bit there. Have a beautiful day. That's PRP.